We're here highlighting some of the great healthcare professionals and organizations that make Greater West Bloomfield a destination for health, fitness, wellness, and everything in between. And a group of people that help to contribute to that each and every day at Greater West Bloomfield's biggest employer are our nurses at Henry Ford West Bloomfield Hospital. Wendy Raffin, who is a nurse and the nursing manager at Henry Ford West Bloomfield Hospital, joins me now at the Health and Wellness Fair. Thank you so much for joining us again this year.
Yes, thank you for having me again.
Yeah, I appreciate having you on. Henry Ford West Bloomfield Hospital, it's one of the most respected healthcare facilities in the entire state of Michigan. How do you believe that nurses and the team of nurses on all different medical disciplines contributes to that at Henry Ford West Bloomfield?
They have an incredible contribution, which is justified by the magnet status that we've achieved. West Bloomfield, particular supporting nursing to have their own autonomy. Get to make our own decisions. We implement changes that we think will improve health statuses across the county, across our system, especially within the community. We try to adapt with whatever is happening in the community and make that work for everyone.
You mentioned a new designation. That was about a year ago that we were talking about that when it was announced and when you were just about to officially get awarded that. Yeah. That's just part of many different ways that Henry Ford West Bloomfield Hospital, Henry Ford Health are impacting with innovation. So how do those innovations, especially technology, play into the role that nurses play every day in the hospital and make them able to do their jobs even more effectively at a place like Henry Ford?
It is always changing. Technology is always there. There's always best practice that is implemented. Right now, we are doing integration, with Epic. We're doing visits with the clinics that are virtual. So people are just generally not feeling well. They really don't have to come to the hospital. They can, do a virtual visit. It's incredible. There's integration with our technology, blood pressure machines that will go right into a patient's chart. So make room for less error. Just increasing accuracy and improvements.
And the communication, too, I'd imagine, also is improved by it.
Yes, beyond. We have a Henry Ford West Bloomfield specific secured communication that is between physicians and nurses, and it's on the spot. So it's usually very accurate, and we get quick results for what patients need.
Yeah, I had an appointment, not at Henry Ford West Bloomfield, but at their new Providence location in Novi just recently for a routine health checkup after a hospitalization last year. And by the time I got home from that appointment, I had the test results in my inbox securely from Henry Ford and your health system. So, I mean, it is immediate communication that really does help. And I'd imagine, too, when you're thinking about talent and recruitment, you're trying to always get more people to come in to the fold because nurses are always something that's needed. So with all the accomplishments, with all the accolades, how does that help in today's day and age recruit and maintain nursing staff at a place like Henry Ford?
Besides Henry Ford West Bloomfield being very sought after, achieving magnet status is incredible. It's very well known. There's only 10% of the hospitals in the entire United States that are able to achieve this designation. So when new nurses or seasoned nurses are looking for jobs, that's a big thing that they're looking for. Are they magnet designated? Do they have that achievement? Do they celebrate nursing? And without a doubt, we have the best team.
Wendy Raffin is with us. She is the nurse manager at Henry Ford West Bloomfield Hospital with us today at our live broadcast from the 16th annual Greater West Bloomfield Health and Wellness Fair. You can stop by. You can join Wendy and the team from Henry Ford Health, one of the presenting sponsors today, the largest employer in Greater West Bloomfield, also part of this event. And interface with the community, it's a huge part of what any healthcare practitioner does in their day-to-day work. But when you're out in the community like this, how does that also help to improve your relations with patients and ultimately make a place like Henry Ford West Bloomfield Hospital even more trusted in this community?
What we're seeing is when we come out to community functions like this, we're seeing, people stop by the booth that say, hey, I was your patient last year. Nice to see you again. So remembering names and faces, and community members continually, come back to the hospital, sometimes as their support system. So another patient's in the hospital and the family is still there. So we're seeing the same continuity, the same patients, and just kind of lifting them up and making sure they've got the care they need.
And I would imagine, too, for the patients, it's a lower pressure environment. For nurses, for other practitioners like yourself and others from Henry Ford Health that are here today, you don't have the grind of, I know I got a patient lined up behind you, and now we're getting behind. You can answer those questions, and I would think that makes people a little bit more apt to ask those questions than they normally would be.
Without a doubt. And communication is key. I mean, that's, many people often come into the hospital or they see their doctor and they think that there's some judgment based on X, Y, and Z. And what people don't understand is healthcare workers have zero judgment between physicians and nurses. Your health status is what we're focused on. And there's no judgment on how you got there. So telling and being forthcoming with that communication is always what we need. So, and it happens often. You just learn to kind of, pull it out of them a little bit, and then it's a wide open book. So that is crucial.
Quite often, especially when we're in the emergency room, the nurses are often that first guard, those first people that we're talking to, and the last people that we're talking to as we leave the hospital or leave these appointments. So in 2025, what do nurses like yourself wish patients knew that they could do when they come into these appointments, when they're in these appointments, God forbid they're in the emergency room, to help make your jobs easier and ultimately their health care more effective?
I'm glad you're asking, but again, I'm going back to communication. In order to take the best care of you, we really need to know what's going on. So there's no judgment. Don't be fearful. We are going to do the best we can, regardless of how you got there. We truly embrace all of that. So communication, being forthright and open, crucial to care.
Well, Wendy, we appreciate your time. We appreciate your insight. This is great information, a lot of which people are going to be able to get by coming out here and meeting you and meeting the team from Henry Ford Health today.
Looking forward to it. Thank you very much.